OJ, I am proud of you.
Hope you are not just looking at his, fine and strong face.
Personally, I think what Achara HOA needs as regards optometry profession or as regards eye care industry is basically education. Education, because a lot of people.
Hi guys, you're welcome to the Zigdara show. Thank you so much guys for keeping it real with us. We really appreciate. So today we have an amazing guest in our midst who is also a true son of the soil, and he will tell us a little about one vital organ that the Bible describes as the light of the body. Because I just mentioned the Bible now, some people are rolling their eyes. If you think I am lying, for my sake, you can open your Bible and read Matthew chapter 6 verse 22. Make sure you thank me later. So, if you're ready for the show, please let's welcome Dr. Nnanna Diogu, our mother.
Ndị ezukwa anwụkwa hụ dọkịta nkandel mikakwa ndị amụdara oke chere ndị ezukwu ndị dọkịta ezukwu bịakwa hụ.
Oh my goodness. Dr. Nana, you're welcome to the show.
It's a pleasure being on the show.
Okay. So, Dr. Nana, please can you tell us how the eyes work? Also, as Ezibonwa Aswamebu, in what ways can your profession contribute to the growth of our community, Achara, EHOA?
Okay, how does the eye work? First of all, the eyes, as we all know, is a sense organ, and of course, one of the most important that we have. Basically, in simple terms, the eye works like a camera, picks up impulses from the environment, just like the lens of the camera, or the pinhole rather, picks up impulses, and of course, basically impulses, and then sends down to the brain through the optic nerve, down the visual pathway to the brain, where those impulses are now interpreted and shown to us as images. So basically what I'm trying to say is we see with our brain and not our eyes. I think in layman's terms, that's just how I can put it for everyone's understanding. Then about how the eyes can or about how our profession, the profession of optometry, can be of benefit to the people of Achara. Personally, I think what Achara HOA needs as regards optometry profession or as regards eye care industry is basically education. Education, because a lot of people, a lot of populates, especially those who are home-based, are very ignorant about a lot of things that have to do with the eye. Trying to, almost everything, trying to juxtapose superstition and sometimes common eye diseases or sometimes common ailments that affects the eye. There was once a case when a man had cataract, and they said something like it was simple cataract that could be removed. So that's one of the cases. So basically, I think our profession can come in the form of trying to educate people on things that has to do with the eye, or things that common diseases that are preventable, and of course how to prevent them, and when it's already occurring, maybe remedies, drugs, or ways out of such things. Basically, that's the primary thing I think optometry profession can do for Achara EHO as a community.
So, Dr. Nana, I want to ask, will sitting close to the computer or television screen, will it hurt one's eyes?
Sitting close to the television or your computer screen, let me take it one after the other. First of all, nobody sits close to the television except there is an error. Most times I get patients come to the clinic, or maybe parents come to the clinic and say, this boy likes to sit very close to the television, this girl likes to sit very close to the television, blah 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 and all. Truth of the matter is, most times the people who sit close to the television sit close to the television because they have an error, not because the television caused the error. It's not the other way around. Watching television or sitting close to the television does not, it's not been medically proven, affects the eyes. But when somebody has an error, let's say myopia for instance, the person tends to go close to the television before the person can see what is on the television. I don't know if you get the drift, but people believe, or most people, Africans especially, believe that sitting close to the television somehow causes refractive errors. No, it does not cause refractive errors. I'm not saying sitting close to the television when you don't have an error is good, no. But sitting close to the television has not been proven to be the cause of any form of refractive error. About the computer screen, yes, there is something called computer vision syndrome, CVS. Now, computer vision syndrome basically has been found to occur in people who, let's say, use the computer screen for a minimum of 6 hours in a day. Minimum of 6 hours in a day. Let's say every day sitting on the computer screen. Let's say customer care representatives, depending on your kind of job that has to do with you sitting on the computer screen day in, day out, 6 hours or more every day. Due to some rays that come out of the computer screen, UV, infrared, at different wavelengths, when they keep on getting into the eye, it gets to an extent where you start experiencing some form of strain, some form of fatigue when looking at, not that you can't see what is on the screen, but you know you're seeing it with some form of strain or fatigue on the eye. It's called computer vision syndrome, and of course there is a remedy for it, just like the lenses I'm putting on. This is an anti-reflective blue cut lens that shields the harmful blue rays maybe coming out from my phone, coming out from the computer screen, from getting into my eye. This is the remedy for it. Yes, sitting on the computer screen in essence can cause CVS. It's not harmful. It's not a harmful situation rather, or it's not a chronic or an acute situation. No, but yes, it causes fatigue to the eye.
Oyi, this one that your eyes are always fixed on the screen. Really need to understand something here so that people like you can do the needful. Dr. Nnanna, please, when should an adult's eyes be examined?
When should an adult's eye be examined? There is no particular time for an adult to have his eyes examined. Normally, what we advise as professionals is a child who has no error, that's for children now, a child who has no error should visit an eye clinic at least 2 times in a year. 2 times in a year. When I'm saying child, between 0 to 12 years, at least 2 times. That is in the absence of an error, in the absence of a complaint, in the absence of that's in the absence of an abnormality. The person should visit the clinic at least two times in a year, once in a year, at least once in a year, 2 times, once in a year, depending on which you can do, in the absence of an abnormality. Then for people between 12 to 30, let's say 12 to 30, it's advisable, this is supposed to be a standard, every 6 months just go for a routine eye check. Every 6 months you go for a routine eye check. That is in the absence of a complaint, in the absence of a symptom, in the absence of any form of anything at all that goes out of normal. You should see an optometrist at least 2 times a year. Now, talking about adults, when I mean adults now, let's say from 30 and above, who do not have issues, same, you visit the clinic at least twice a year. Then when there is a symptom, or when there is an abnormality, when there is a refractive error, irrespective of how little it is, depending on which, some cases such as maybe you're managing glaucoma, cases such as maybe cataracts developing in the eye, cases as age-related macular degeneration, cases like let me not bore you with the names, but there are some cases that actually require monthly visit to the optometrist. So there is no stipulated time. There is no let's say this is when an adult should visit the clinic, no, or this is when an adult should not visit the clinic. There is no stipulation. But on a norm, when you do not have a problem, 2 times a year, once a year, depending on which you can do. Then when there is a problem, Of course, the professional, the optometrist, the ophthalmologist, as the case may be, would be the one to tell you, visit me so and so time. Some cases require daily visits to the clinic. Some very acute cases like acute iridocyclitis would require you visiting the clinic, of course, almost on daily basis until the situation is put under control. So there is no stipulated time per se. It depends. But in the absence of an error, at least twice a year, once a year if you can do it, but at least once in a year you should visit an optometrist.
Does drinking Gary okay, does drinking Gary really and truly lead to visual impairment?
Gary does not lead to any visual impairments. That's another myth. It does not lead to any visual impairment. I'm not encouraging soaking of Gary all the time, but it doesn't lead to any visual impairments, not at all.
Okay, that question is so personal.
Ongogare, Ngoroje, I am proud of you. So Dr. Nnanna, before I let you go, let me ask you this very last one. We really need to understand something here so that we won't go out there and disgrace our village people. So what's the difference between an ophthalmologist, an optometrist, and an optician?
The difference between an optometrist, an ophthalmologist, and an optician. I thank you for asking this question, because this is another part or another topic where I feel many people are misinformed, or many people do not or cannot tell the difference. Yes, I'm an optometrist, and an optometrist is an eye doctor, who has passed through 6 years of medical training in the optometry field, and graduates after 6 years with the Doctor of Optometry degree, OD. An optometrist is not a medical doctor. They are two different categories. A doctor of optometry, an eye doctor who has passed through optometry training for 6 years, and of course a 1-year internship program after the 6 years before you can be fully licensed to practice optometry. Now, an optometry detects errors of refraction, and of course treats with glasses and contact lenses, errors of binocularity, and of course treats with prisms, orthoptic training, visual training, as the case may be, and also errors of deviations from the normal workings of the eye, and of course minor infections or pathological errors, conjunctivitis, keratitis, uveitis, as the case may be, and of course treats with drugs. Now, on the other hand, an ophthalmologist is a medical doctor who has passed through school for 6 years, and an additional 4 years, that's after the 6 years, an additional 4 years of residency, ophthalmology residency. A medical doctor who has passed through school for 6 years, and another extra 4 years to become a resident, to become a consultant in the field of ophthalmology, that is, specializes on the eyes. Now, an ophthalmologist, or rather ophthalmologists, are eye surgeons. They are the surgeons. They are the ones that perform surgeries. They are the ones that have to do with, they do every other thing that the optometrist does, and of course they also perform surgeries on the eye. Then an optician basically is a technician whose major roles involve fabrication of lenses, lens blanks, glazing, polishing, and all whatever technicalities involved in optometry profession. That's basically who an optician is. So the optometrist is the eye doctor, the ophthalmologist is the surgeon, the eye surgeon, and the optician is the technician. So that's about it.
Wow, I am enlightened. With you, our eyes no go fit suffer. I am abafozo, anyị jam zozo guy. Ọzọ bụ nnọọ.
Hello, Merewo. Hello, Dimwene.
Thank you, Dr. Nnanna, for joining us today on this show. I and Ola, we're so grateful, but we hope and we expect to see you on this Sigdara show some other time.
Okay, so thank you very much for having me. Thank you very much for having me on the show, and I hope the maiden interview has really gone a long way to, of course, enlighten a little bit of our people, a little bit of the populace of Achari Echiawa. And I hope to be on the show some other time. Thank you very much.
So guys, we've come to the end of today's show. Wait, hope you guys learned something. Oh, it's not all about looking at our fine Aswami doctor, our Aswami men. If you keep looking at Aswami guys, because Aswami guys are hot, they are hot.
They tell you.
If you get what I'm saying. But then, hope you learned from Dr. Nnanna, because me, I learned a lot. But you see that Gary part, I'm still learning. And guys, in case you don't know, this fine, handsome Aswami doctor is Ola's brother. So guys, thank you guys for watching today's show. So please click on that subscribe button and the like button and the notification bell. Until next time, we remain Onyinye and Oledo. And guys, please remember to take care of your eyesight, because without those eyesight, you can't see me and I can't see you. Look at it. So take care of your eyesight. Guys, I love you. We love you.